If you're giving something a drug and there's a problem, the symptom is actually your body trying to adapt to the problem. If you have high blood pressure, there are a million reasons you could have high blood pressure. One of them is not the fact that you are deficient in a high blood pressure managing drug. I promise you that. You don't have high blood pressure because you have a lack of a high blood pressure managing drug. You have high blood pressure because there's a root cause, something that's going on, and then your body is adapting to that thing by raising your blood pressure. One example, when we eat things we shouldn't eat, okay? So like in our bloodstream, our pH in our blood should be pretty neutral. But if we start eating things that cause either acidity or alkalinity in our blood that go outside of what's the homeostatic range in our blood, do you guys know that term, homeostasis? It means neutral, what your body wants to operate at, what gives life. So if we're eating things that are driving us into acidity or alkalinity, alkalinity is pretty abnormal, acidity is pretty common. Sugar breeds acidity. So if we're eating things that are creating a lot of acidity in our blood, what it does is it starts agitating our blood vessels to the point where they start becoming inflamed, and it starts eating away at the lining, which is made out of a healthy fat, and then it starts destroying the integrity of that blood vessel, and eventually you actually start having microbleeding or microtrauma on that blood vessel. Am I getting too deep for you guys? I'm jumping in right away, okay? Because this is huge. When you start bleeding internally, you're losing blood, which means you're losing blood pressure. So what does your body innately know to do? It either increases the strength of the pump, your heart's going to either be harder or faster, and you're going to accommodate for that, and you're going to start actually elevating the pressure within the vascular system to accommodate for the blood that you're potentially losing. If you take aspirin, this happens because it creates microbleeding within the intestinal tract, and you're losing blood, whether you know it or not. They say regular aspirin use, people are literally tablespoons of blood at a time that they're secreting into their tissue. And that blood isn't designed to be in that interstitial tissue, and it also has other things like proteins and all these structures, and we can develop allergies to these things once it starts leaving our intestinal system. And so now multiple things are going awry, but let's focus on the pressure. Pressure's going down, heart starts pumping harder, it's driving the pressure up, it's gonna overcompensate typically, and so it overcompensates, and then you go to your doctor, and what do? Here's a blood pressure medication. Let's just lower your blood pressure, chemically. And you lower your blood pressure, but did it fix the bleeding and the microtrauma? So the bleeding and the insult and the injury over time, if you don't change anything, it's gonna get better or worse over time? It's gonna get worse. And then so down to the problem, the heart has to react even harder, right? And the vessels start constricting, the heart starts constricting, pressure goes up even more. What do? They put you on more medication, maybe even another medication. And all of a sudden, now the problem's getting worse, the symptoms are actually stabilizing, but the problem's getting worse. What's going to happen over time is you're going to develop some sort of vascular disease. And the reality is we were never treating the cause of the problem. We were treating the symptoms of the condition, and that's what modern medicine is.